Get ready for a thought-provoking episode as we welcome special guest Rita Rogers to discuss the importance of caution for families navigating today's complex world. We'll also investigate the potential dangers of fluoroquinolones and challenge common misconceptions about ADHD. Tune in for an enlightening conversation that will leave you better informed and empowered to make the best choices for your family.
The Discovery Doc Podcast, where your journey to empowered, non-toxic living begins. Join me, Dr. CeCe, a doctor of nursing practice, self-proclaimed toxin tamer, and mama of four, alongside
me, Annah Kate, your medical mystery overachiever. Together, we'll uncover the latest in functional medicine, debunk health myths, tame toxins, and provide practical tips for thriving in a modern world.
Get ready to take control of your health with expert insights, raw stories, and actionable wellness strategies designed to help you and your family lead vibrant, toxin-free lives.
Let's discover together.
Welcome back to the Discovery Doc Podcast. This week, we are back with Rita Rogers, and we are going to dive in deeper with her and get her perspective as a mom and a nurse.
Yes. So if you guys didn't go back, or if you guys didn't listen, go back and listen to the first one. We took some turns that I'm very proud of. I love the turns that we took.
Rabbit holes.
We went down some rabbit holes there. And now I want to go down the mommy rabbit hole. So you mentioned that you stuck with being a CVICU nurse and then had your kiddos. Since just how has your experience, whether it was as a nurse or in the medical field or whatever it might be, how has that morphed and shaped who you become as a mom and how you choose to run your household or parent or even make informed decisions about your kids' health, especially when they were little, like 1, 2, 3, 4, there's so many things going on. How did you manage?
CeCe, I love this question, but it's really hard to answer because,
4 questions.
I was a nurse the entire time that I was a mother, or that I have been a mother.
Yeah.
I've never had the experience of being a mother and not being a nurse. So I don't have perspective on what I would have been like had I not worked in the ICU and things. But I can tell you that generically, I guess, that it's really caused me to ask questions. It's caused me to realize that people can't be blindly trusted because they have credentials behind their name. That doesn't really mean anything. It just means they went to school for something and got a degree. It doesn't say anything about their ability to ask questions, use common sense, and apply information to everyday scenarios. I guess being a nurse has allowed me to be a better friend to my mom friends. It's helped me help them when they have situations arise. I could tell you of multiple friends that have had children that I have diagnosed after they've been to a doctor and wrongly diagnosed and help them go back and get the treatment that they need, those kind of things. But like a really specific thing that I could tell you it's helped me with is seeing how diagnostics are used today in the hospital system and the medical system, and avoid doing things to my kids or help friends avoid doing things with their kids that aren't necessary. So this is really specific, but for example, x-rays. If you ask, so a lot of times things that happen in the hospital are based on algorithms now. If this, then that.
Right.
And before a doctor ever sees a patient, a lot of times order sets are put in and things are done to the patient, without the doctor ever laying eyes, just because this patient fits into this box. And so, for example, a kid breaks their arm. There's going to be this, or maybe doesn't even know if their arm's broke. They come in with a hurt arm and there's this x-ray set done before the doctor ever sees them. And then, they get sent to an orthopedist, and the orthopedist wants a different type of x-ray set. And so there's this x-ray set done, questioning like, how is this going to change the treatment? Could that first x-ray set be used? Like things like that. Like, how is the diagnostic test that you're asking me to do going to change the treatment plan? And if it's not going to change the treatment plan, why are we doing it? And is this diagnostic test in any way harmful to my child? Or is it completely benign? Like, is there no effect? And with x-rays, that's something specific, but I really try to avoid with my kids. And I have, had a daughter break her arm, and we have avoided some x-rays, not all of them, but some of them, and massively reduced them just by asking questions and talking to the doctors. And they're like, oh, no, we don't need that. Oh, well, I just saved my daughter 4 scans,
Yeah.
that kind of thing.
Do you think that I like this question. Do you think that your experience has made you more confident to be that person for
Absolutely.
your kids?
Absolutely.
Yeah.
I think, that's one thing that I think is very sad. Like, it is so sad, the hubris in the medical profession, just walking in and the doctor making you feel dumb for even asking a question. Like, how many times did I hear a doctor say, where'd you look that up? WebMD? Well, yes, we have this wonderful thing called the internet now, and everybody can basically get the textbook education that you got online. They might not have the experience that you have in the hospital, but they can get the textbook education. I just think if there are doctors, there are good ones out there. They're a needle in a haystack. My friend just said that the other day. She's dealing with some stuff and she said, there are good doctors out there, but they are like finding a needle in a haystack. And that's so true. But the good ones ask questions to their patients and they listen when questions are asked. We can be so much more intelligent and so much more capable of helping people when we're just willing to listen and ask questions.
100%. And not getting our feelings hurt. If you ask, I don't know the thing is, and I don't know where, especially for MDs, there are certain MDs that I love, but I'm sorry, y'all. Especially with MDs, there's this complex. There's always a complex where if I ask you a question, I'm challenging you. Why do we automatically go to a space where we're feeling disrespected or challenged? That is, if any of my patients ask me a question, I don't care. I don't in my heart, I'm not oh my gosh, they are challenging every single ounce of education I've ever had and my degree and all this stuff. I don't go there at all. And if I don't know, I'm going to go find out. Or if I do know, I'm going to have an open conversation with you. I don't understand where that challenge mentality came from, where it's wrong. And that is, to me, very immoral, because then it just creates this dynamic between you and a patient that's where they just blindingly should follow you and trust you without any sort of mutual kind of respect, or I don't know, trust is earned to me in terms of a patient relationship. And so when my patients come to me initially, they don't know who I am. I know they came to me specifically for a reason, and usually it's through word of mouth, but you don't know what I could do for you or not. It's a learning process. It's a trusting process. So please ask questions, get to know me, get to know what we're doing. I just don't understand where that egotistical, challenging,
It's the white coat complex. So when a doctor puts on a white coat, it has that authority of I should be able to ask you a question. I'm supposed to be able to get all of the information, and I'm also supposed to get the best information for me. Well, that's not how it works, because allopathic doctors are going to tell you what they're trained on.
Right.
They're not going to tell you, so whatever pharmaceutical is in their back pocket, and the one that they're pushing that month is the one that they're going to go with 90% of the time. Now, this is a blanket statement, but it's also when it's that, not the white coat complex, it's the white coat phenomenon or whatever it is. So they did this whole study where they had people put on a white coat and
funny.
And so you don't usually wear a white coat.
I don't.
Yeah. So you're more personable because you're in your scrubs, you're doing your thing. But there's something that is intimidating when a white coat is put on and someone walks in the room, whether they're a doctor or not.
Right.
So this study did it with non-doctors. They just put people in white coats, and they could walk into a room with another person and tell them anything, and the other person would believe them.
I think the other huge issue that I try to remind my patients is you know your body better than I do. We might have a difference of education, and I might be in this field for a reason, but nobody on this planet knows your body better than you do. And so who am I to come behind that and challenge you as the person who has lived in your body the entire however many years that you've been on this earth?
Full time, every day.
Who am I to challenge the knowledge that you have of your body? That's what really gets me. It's I understand people end up, if I have patients who Google their lab, their labs that we do, and they're like, I'm dying, I'm dead, put me to play. I'm like, no, that's not it.
Yeah.
Let's go through this together. So there are definitely times where I'm like, y'all just have a conversation with me, just get to our just talk about it. But then there are times where, yes, there's so many resources out there. So there's so much information. My patients are intelligent. They can do their own research. They can do their own, just studies. And then they also bring the factor of knowing their body better than I do. And that is something that is invaluable.
Yep. If you can't ask a doctor a question, you're with the wrong doctor.
100%.
Yeah, absolutely. Because doctors all go to school at a different time and they all receive a little bit different education because things that we're learning are changing. Like the human body, this kind of blows my mind. It's so simple, but it blows my mind when I think about it. It's just that the human body is not changing, at least on a macro evolution perspective, maybe little micro evolutions, but we haven't changed in hundreds of years. But what we know about the human body and how we treat the human body based on disease process or, whatever has changed massively. So to assume education is static and unchanging is so dense. That's so,
You're gonna get feeling because yes, then how the standard of care that we utilize, I don't utilize, the standard of care that conventional medicine utilizes is how many years old also. So even though knowledge is rapidly changing, we are still basing standard of care from 50 years ago. It's just, there's so many dynamics to that. Deep dive question. What is, in terms of just you and your family and your children, what is something that from your knowledge, from your research, from your experience, whatever you're drawing upon, and this could be so random. It could be a food that you won't let them eat. I don't know. What is one thing that will never let your kids do? Ever. Point blank period, done.
Never do to them or never let them do.
Yes.
Oh my gosh.
I know.
This is hard, but I would say putting an iPad in front of my kids when they're little.
Yeah.
I think that's the never for me. I know that people are like, oh, but there are circumstances where it's easy. And I'm like, yeah, that's true. But with my oldest, she's 14. I never gave, and it wasn't a topic at that time. I was a very much the weird parent, but never put an iPad in front of her. I mean, now she's 14. I homeschool and they'll use their tablet to look up art projects or watch their news program. But my kids are never on YouTube, just looking up random videos. No, my 2-year-old, almost 2-year-old, never in front of a TV or watching an iPad. I think it destroys their creativity, destroys their ability to communicate with people, makes them little insane monsters. And I watch it from other kids, and I'm not judging other parents. There's just a knowledge deficit there, I think, but won't do it.
Do your older kids have phones?
No. Well, actually, just a few months ago, I activated a Gab phone for them so they can text. Their grandma's in Florida for the winter, so they'll text her maybe once a week, and then they have it for when they go babysit. So they can get a hold of someone because there's no landlines anymore. So I was like, oh, when they got asked to babysit, I'm like, they need some way to get a hold of people. So I activated a Gab phone for them, but otherwise, no, they don't have cell phones.
Yeah. I love that. We have a strict policy in our house so ours are a little bit younger. We have 8, 6, 3, and 1. He just turned 1 a couple days ago.
Oh my gosh.
I know.
He's walking.
He is. He's all over the place. But we drive a lot. We drive 12-hour car rides quite a bit. So, I mean, and then 3-4-hour car rides. Unless we are in the car for longer than 4 hours, or if we are on a flight for longer than 4 hours. So if it's under 4 hours, nothing, never. If it's over 4 hours, we bring their iPad, and they have 2 set kind of segments where the first half they can watch a little movie or do a game, and it's set for an hour and a half, and then set segment on the latter half of the day, and that's it. And so they know that those are the parameters we set from day one. Is they don't watch TV, they don't watch movies, they don't have iPads, they don't have phones in terms of everyday life. But if it's a trip over 4 hours and we're stuck in the car, then yes. But and I think that for us was a good happy medium because they now monitor it themselves. They will choose.
Yeah, that's good.
We don't have to pull it away. We're not hey, time's up, and there's these huge outbursts. Ava will actually stop before the hour's up and be like, I'm starting to get a little headache, I'm just going to read. you know, she'll make that active choice of putting it down. But something I told Anna Kate this a while ago, something I was so proud of was she does competitive gymnastics, and she's one of the youngest. And so all those little girls, our kids are homeschooled also. But all these little girls are older and they have phones and they have access to YouTube and all this stuff. And Ava didn't know I was there, and I was picking her up, and she was sitting down next to one of the little girls who's a little older who was on the phone. And I was like, I just want to watch. I just want to see like what Ava will do, or what, you know, how she's going to react. And she like looked down at the phone and she was like, what's that? And the little girl was like, it's YouTube. And she was like, I don't know what YouTube is. And she walked away.
Sounds funny. Instead of just saying, oh, what's YouTube? She says, I don't know what it is.
No, she's like, I don't know what that is.
Yeah.
She walked away with like such confidence. And I was like, yes,
So
like
sweet.
amazing. That was
It's
my
so
mom
hard
one.
to pick like a never for your kids, because I feel like parents always say like, I will never do that. And then, you know,
And then it happens.
yeah, but
Yeah,
it's hard to pick a never, but I don't know. Yeah.
I agree. It does turn them into like if we're at friends' houses and they have the TV on, because my kids don't have that much access to it, they're like this.
Yeah.
And I'll be like, Jackson. And they're so enamored by it that I'm like, it's mind numbing. It is so mind numbing, but it's wild to see like kids who don't have that exposure versus do, and how they react when they do come across it.
Did you grow up watching TV?
No, not. I mean, I think my mom, in the abyss of my memory, I remember like grade school, like coming home and every once in a while having the TV on. But we were so busy. I played like every sport known to man. I mean, I was like probably too much. I don't remember it ever like growing up, like when I was a little kid, because I do remember having sleepovers in like 5th grade, and they would let us watch Saturday morning cartoons. And I remember it being such a big deal because we didn't watch ever.
Yeah.
Ever. So definitely not before probably 7th grade.
Yeah, we couldn't watch during school. Like if it was either the news or if my dad had like Andy Griffith on or something, but we didn't watch during the week. And then Saturday mornings, I'm watching cooking shows. Like I'm watching like Yan Can Cook and Talia and like all of.
You know what's so funny is
that was my Saturday morning.
In high school, what I do remember was high school. My dad and I used to watch House. That was like my favorite show ever. Oh, I loved it.
So what about you, Rita? Did you grow up watching?
When I was a kid, it was like Walker, Texas Ranger, and Dr. Quinn. Like I'm that old.
Dr. Quinn medicine.
Like it's and Saved by the Bell on Saturday morning. I mean, shows were different then.
I know.
Too.
I was like, no, I do know Saved by the Bell. I mean, I know the name of it, but I don't know it. But
I'm showing my age right now.
You on the Dr. Medicine Woman and Sully train. I mean, Sully was like
actually, yeah. So my older kids, like I'm not a no TV for my older kids at all, but it's not on ever during the day, like a little bit at night here and there. But I actually recorded on one of the channels that had Dr. Quinn on, like reruns, and I recorded them a few years ago and they were watching through them and they loved it. It's a pretty good show, actually.
Oh, okay. I'll have to look at, well, we don't have cable anymore. We actually got rid of
Jane Seymour.
Yeah. It's a good, wholesome, it's kind of
like that other movie that you referred to that movie like last year all the time, and it had you thought of it with when we said the Astrobolome.
Oh yeah, the Biodome. Did you ever watch that movie Biodome?
I don't know. I know what you're talking about. I've heard of it.
And
she referred to it like 5 times last year. I was like, okay, I need to watch it. And then life happened and I did not.
Maybe I'll have to watch that one.
It's just dumb comedy, like 90s comedy. So
I'm down for that.
Yeah. And crass now, but it was funny then. And it was like, it was a thing. But yeah, so it's like Little House on the Prairie, but older and more. There's more medical things involved. So it would be great. Like Ava could watch it with you. It would be safe enough for Ava to watch. I think. Mm-hmm. Yeah,
we'll see.
Well, I mean, she's pretty good enough to grasp the concepts, and it's not overly. It's not like Grey's Anatomy. Like it's not. It's not that far.
They don't put all this stuff in the. I don't know. All the like sexual stuff was not in those shows.
Yeah,
that they do. Like all the there's relationships, but it's not the same as the evening TV now.
Right.
It's family programming.
Okay. Cool.
Yeah.
Take a gander.
All right. So if you have a question for the Discovery Doc or our guest, let us know, drop a comment below, and we will get back to you and join the conversation. We'd love to be able to answer any questions you have either in the comments or on a future episode. You might think avoiding fluoroquinolones is easy, but what if I told you it's hiding in some most unexpected places? Today, we're uncovering where this toxin sneaks into your everyday life.
Hey,
okay, so
the
it's
drama.
It's not just from your doctor.
Okay, no.
Pumping you full of pills and putting Band-Aids where they don't belong.
Okay, AK is on one today, guys. Sometimes these antibiotics are needed and they are very, very life-saving, okay? And we're going to put that disclaimer out there. Fluoroquinolones are what we're talking about. They are prescribed antibiotics. So yes, obviously you'll typically encounter them through your doctor's prescription for a bacterial infection. But what I want to talk about on this segment is actually they're commonly used in veterinary medicine too.
Oh,
which means that means we can also be eating them. Not our puppies. We're not eating our puppies.
Don't eat your puppies.
Okay, stick with me, guys. Anyways, so again, fluoroquinolones, they're broad spectrum antibiotics. What does that mean, AK?
That means that they cover both gram-positive and gram-negative. If they don't know specifically what they're targeting, they can do a cover-all and try to catch what they can.
Exactly. Making them a go-to solution for treating various infections in both animals and humans. For example, GI issues, skin issues, respiratory issues, bladder infections, urinary tract infections, kidney infections, you name it, even surgical wounds or procedures. So that is typically, yes. Oh, gosh.
Question.
Yes.
No. Can they? Okay, so here's a question. Do they use fluoroquinolones for fish? Do you know?
Okay. Do you mean like your pet fish or like farming fish?
Like farming fish.
Oh, that's a great question. I don't know the answer to that. I know dairy, meat, eggs are a big one.
Okay.
And there's not such great ways of utilizing them. I don't know about fish.
If you know the answer to that question, please drop it in the comments below.
Yeah, because I feel like farmed fish definitely use preventative antibiotics because they are keeping them in such close proximity, and then disease rate goes up. But I don't know what antibiotic for fish they go to.
Good to know.
The snots.
It's okay.
Getting me.
It's that time of the year, y'all.
It is that time of year. Oh, I can't get it out. Anywho.
If this is not bothering you, go listen to Jace trying to breathe and nurse, and then come back to this episode, and she's super quiet.
Oh,
poor baby.
My baby.
He'll grow out.
He will grow out of it. So fluoroquinolones, they're super effective. They work efficiently by eradicating a variety of bacterial strains, especially those that are the toughest to eradicate. With animals, livestock are traditionally what fluoroquinolones are used for, especially in commercial farming. So where there's rapid growth and disease control are major factors. They're kept in close proximity, that they can use them for either high risk animals, especially again in intensive farming systems, B, if there's actually a bacterial infection. But when you have animals that are in high stress environments and unsanitary conditions, and antibiotics like fluoroquinolones can actually be used to prevent disease and bacterial diseases being spread amongst herds or flocks. That's where I have kind of an issue. Is like, I get not wanting all your animals, your hundreds of animals that are in close proximity getting sick, but then you use such a broad spectrum antibiotic as preventative when this can also contribute to humans becoming resistant. Like, choose something else, bro. Yeah. Choose something else, because it has been proven that when animals are treated with fluoroquinolones, that residue of that drug is in their meat, in their milk, in their eggs. So it's another way that we are consuming that antibiotic, although indirectly there's still residue of it left in the meat products that we are eating. So to use that to quote prevent disease, you're putting us humans at risk. Like, God love the animal, I'm concerned about you too, but
you eat what your food eats.
Yes, absolutely. And that resistance that we've been talking about can transfer too between the animals and humans. The development of antibiotic resistance bacteria can absolutely be transferred to humans through consumption of contaminated animal products, or even the contact with those animals, or the environmental exposure, whether it's the water runoff or manure. So that is just contributing to the possibility of such a broad spectrum antibiotic, and an effective one leading to ineffectiveness of very common antibiotics, making it harder to treat infections in us, but also the animals. I have an issue here.
Clearly. I mean, and there is so many, healthy farming practices that lots of farmers have adopted and to kind of mitigate this, because nobody wants to be sick and nobody wants to take care of somebody that's been sick. So granted, she had a little one that just had an upset tummy last night. So
oh my gosh, she puked at 1:30 for no reason. No reason. Our kids, like the older three, they sleep in the same room because they're adorable.
Because they want to.
Because they want to.
They have their rooms, but they all want to sleep. They want to.
And Ava runs out at 1:30 in the morning, and she's like, "Mommy, I'm dead asleep in the bed, dead asleep." Yeah. And she's like, "Mommy, I don't know what Jada ate, but she just threw up everywhere." Great.
Poor baby.
Great. It was a one-off. We're good. We're fine.
So it is inconvenient for things to be sick in your house and in your livestock, right? So doing the best practices. So again, having Jada, who knows what Jada, just a bug or just something that happened. But if she had eaten something that did not agree with her, like she's not lactose intolerant. Is she like her dad?
Not to raw. No, we do raw milk and raw dairy, and she's fine if she has like conventional dairy products. Yeah.
Okay. So knowing what you do need to eat, and also knowing what goes in that cheese and what goes in that butter and what goes in that milk really make a difference. So this is more for your education and awareness of, hey, these things could be in my meat. And is this just on the conventional side, or is this on the organic side as well?
So you definitely have, when in choosing solutions for your family, choosing organic, antibiotic-free, grass-fed products, where they legally can't be treated with something like fluoroquinolones or synthetic drugs, but it's just about knowing the sourcing. Like this is literally what you're fueling your body with and your children or your family's bodies with. So understanding where is this livestock being raised? What are they eating? What are they exposed to? And do I want to then be consuming that? I think that is like of the utmost importance. So I'm crazy. We order our meat and our raw dairy from a farm in Pennsylvania, because I do like one bulk order per month, and it's just easier, and it comes, frozen. Because I know the sourcing, I know everything that these animals are exposed to, and that makes me feel good.
Good.
Yeah.
We'll have to put a link in and share.
Yeah,
share what
absolutely. I love them because it's all in one-stop shop. I was going to different farms before, but I was having to get like my chicken and my beef from one, and then my raw dairy from another, and my eggs from another. And this I just get all together.
Oh, good, because eggs are hard to get.
Yes, I get 72 shipped to me.
Do any of them come broken?
No, they have it down pat. So they have this huge box, and they have foam, and the foam has little divots cut out for each egg.
I love it.
And they came perfect, none broken.
Okay, now does that packaging compost? Is it that foam that like if you wet it, it disintegrates?
Yes.
See?
Exactly.
Look at there. Look at there.
Anywho, so I want to talk next segment on the potential dangers of fluoroquinolones, and something I think that every patient should be taught. If your doctor is really needing to prescribe you fluoroquinolones, what is the possible adverse reaction or adverse outcomes from it? And then how can we avoid them if necessary? So stay tuned.
Do you want more game-changing content? Join our email list. We've got all kinds of cool things. We're coming out with some free guides, so make sure that you hop on that to get those delivered directly to your inbox. We'll let you know when those are available. It's a health fact everybody seems to believe, but is it actually true? Today, we're putting ADHD as a brain disorder that requires medication to the test and breaking down what science really says.
Oh, this is a good one. So ADHD, we know most of us know, is a diagnosis that occurs when you're a child. Yes. Oh, you already have a question?
No, attention deficit hyperactivity disorder. Hyperactivity is one.
I had a whisper.
Okay, sorry, I'm looking for the other A. Wait.
So kids, adults can be diagnosed with it, and it's generally treated as a genetic chemical imbalance that requires a stimulant medication like Adderall, Ritalin, et cetera. There's Focalin, there's different types of medications out there. However, when we in the functional medicine world see a child or an adult with ADHD, I'm not going to say I treat it as a symptom. I don't treat it as a disease. I treat it as a symptom. So that's kind of what I want to get to, because ADHD has exploded in recent years, especially in kids. I mean, I had a 3-year-old who was diagnosed with ADHD the other day. I sure as heck did not diagnose her, but she had a full diagnosis at 3 years old of ADHD. I'm sorry, what? My 3-year-old can't put her shoes on the same way anytime that
We even have stickers in her shoes, and they're different colors.
Like a 3-year-old, you're labeling a 3-year-old with ADHD. That is absolutely crazy to me. But is it really a disorder? Or is it kids who are struggling with poor nutrition, toxic overload, and lack of movement, all the above, inflammation, gut dysbiosis, nutritional deficiencies, environmental toxins?
Yeah.
That is where I want to get to with this myth.
How many flaming hot Cheetos was this 3-year-old eating?
Oh, right. Soda. She drinks soda.
That'll do it.
I know. So as we talk about kids, age matters. Kids that are...
Somebody gave their 3-year-old soda?
I know.
Sorry.
But when you look at
Don't do that.
even the medication, so kids at 6 years old, 5 years old are being put on stimulants like Ritalin and Adderall. And those don't fix ADHD. They're literally like, can I say this word?
Yeah.
One?
Yeah.
Okay. Those drugs act like legal amphetamines. That's what they do. And so one, it's providing temporary relief. But 2, it comes with potential adverse effects more acutely, like changing our appetite, like mood swings, like sleep issues, or even dependence in the future. Number 3, there are so many studies that chronic use of these medications, which they are chronically used, puts us at higher risk for neurocognitive disorders later in the future. There's a direct correlation. Why? Because it is it is severing the feedback loop between our GI tract making certain neurotransmitters and our brain receiving those neurotransmitters. We're cutting that off. So the brain does not understand how to operate then without this medication.
Yeah.
So you have a lot of kids who have an issue getting off of them for that reason.
Yeah. So Adderall and Ritalin are not amphetamine deficiency drugs. No one has an amphetamine deficiency. It's not a thing.
Exactly.
So we could address the food or
the actual neurotransmitters.
Right. Instead of letting them eat whatever they want and then addressing the symptoms with something that's also going to cause adverse effects down the road.
Right. So where do you start? You start with that gut-brain interaction. To me, ADHD, that symptom, it's a symptom. If a child cannot focus, if a child has inattentiveness, that is a symptom. Why is it occurring? Go find the why. And usually it starts within the GI tract. There's tons of literature that tells us that leaky gut and inflammation within the GI tract, it has a direct correlation with ADHD. That GI tract or that gut dysbiosis can lead to further systemic inflammation, which can actually impair our neurotransmitters and how they function in the brain. So 2 neurotransmitters we make in the gut specifically are serotonin and its byproduct, 5-HIAA. This is like the feel-good neurotransmitter. It's the calming neurotransmitter. And so if your gut is a hot mess, guess what? You're not making that neurotransmitter enough. So what do we have? We have the opposite of calmness.
Yep.
We have agitation, we have aggressiveness, we have hyperactivity when not enough of that serotonin is being made. So the role of the microbiome in the function of something like serotonin and dopamine, which is our feel-good kind of pleasure sensation, there's a direct correlation there. So 2 things I look at initially is the GI tract and then the actual neurotransmitters themselves. We can actually test for neurotransmitters and look at the excitatory and inhibitory neurotransmitters and see where there's dysfunction. Are the on switches too on and you don't have enough of the off switches to turn it off, or vice versa? And even that to me is a Band-Aid. If I see that and I see a kid who has these neurotransmitters that are off, even if they're on medication, what I like in that moment is I can even out that playing field. I can bring that teeter-totter in balance with itself, but I still ask why. I'm still like, well, why are those neurotransmitters off in the first place? Because I don't want you reliant on a supplement for the rest of your life to balance that playing field. So why are they off? And that's where digging into the gut health is a really great place to start.
Moving from a prescription to a supplement is not, it's a more natural path, but it's not an end all be all. But if you fix your diet and your screen time and exposure to toxic chemicals and food dyes that would reduce that behavior. We even talked about how having the right food reduces aggression in prison populations. Like there's
direct correlation.
Yeah.
Yeah. And part of that comes from the synthetic ingredients and the inflammatory kind of cascades that can send a patient down. But the other side of it is the deficiencies that it's causing. If we are not eating nutrient-dense whole foods, we have micronutrient deficiencies that are occurring because those synthetic chemicals are not replacing good whole micronutrients or good whole foods that can increase our micronutrients. And so part of the problem there is the deficiency. And a lot of kiddos with ADHD, they have omega-3 deficiency, which can be found in wild caught fish, grass-fed meats, flax seeds. But a deficiency there is directly linked to impulsivity and hyperactivity and poor focus. Magnesium and zinc, same thing. Both are critical for specific neurotransmitters like our dopamine regulation. A lot of kiddos are deficient in magnesium and zinc, as well as blood sugar dysregulation. So when we have a blood sugar that spikes and then crashes, that directly can lead to mood swings and poor focus, and decreased energy and impulsivity and lack of concentration, just because we're going up and down so quickly. So what helps to stabilize that blood sugar? Good fats, good protein, not processed foods that bump it up super quick and then you fall down.
Yeah. So if you have a toddler or someone that throws temper tantrums, fix their diet, and it will make your world a whole lot better, a whole lot faster.
Yeah, some specifics too, in terms of the other side. So not eating nutrient-dense foods can cause micronutrient deficiencies, but then eating kind of the other side and the highly processed foods, there are chemicals there that have been directly linked to ADHD. Food dyes are a big one. Red 40, yellow 5, yellow 6, blue 1 have all been linked to hyperactivity in kids. And that's why they are banned in the EU or labeled with caution may cause hyperactivity in children.
Yep. I talked about that in Colorful Culprits. Yeah. So if you want to go back to our Halloween episode and grab that download, you can go grab that.
Yeah.
About those.
Heavy metals. Heavy metals are a big one where there are direct correlations with kiddos who are exposed to high levels of lead and mercury and pesticide exposure because it disrupts brain function, as well as glyphosate, which we've talked about in previous episodes. That is linked to behavioral issues. Anything from that to things like EMFs and ADHD-like symptoms. There's a direct correlation between our exposure to Wi-Fi and tablets and screen time and cell phones. Why? Because it alters the chemicals in our brain. It alters that dopamine production and our ability to focus, because that constant stimulation, kids are getting this constant instant gratification that when you then take that away, now they can't sit still. Yeah. Why? Because their brain is constantly inundated with information because they're scrolling through certain things on a screen where it's direct input.
Yep.
So consistently. You take it away and now they don't know how to be bored. So it presents as a symptom of ADHD.
Adults can be affected by this
100%,
too.
100%. So when I'm dealing with a kiddo or an adult who has ADHD, number one, it comes down to kind of my progression is diet. Okay, what's going on in the diet? Are we removing inflammatory foods? Are we increasing good proteins, healthy fats, whole foods? That right there can be enough sometimes. Step 2 would be testing and targeted supplementation. So I look into the GI tract, I look into neurotransmitters, and then I look into other either viral agents or bacterial agents that can disrupt our central nervous system that can impact those neurotransmitters. Because again, it's not an answer for me to just supplement for the rest of your life.
Right.
In doing so, I can really help kids or adults either get off of their medication, because that neurotransmitter test can tell me where I need to fill in the gaps and the holes so they don't rebound, or prevent them from increasing the need to increase their medication. Something as simple that usually comes from the direct testing of the neurotransmitters, so I can see exactly where they need to be kind of pumped up. Saffron is a really, really great natural remedy that has direct impact on our attention and focus. That is one that can help no matter what kind of the neurotransmitters are doing. The figuring out the kid's learning style is also huge. There are some kids who are not meant to fit in a box, who are not meant to just sit at a desk for freaking 8 hours a day.
Or they put tape on the floor around their desk. They can stand up within the tape, but that's still not enough to
And so they get smacked with a label of ADHD because they can't sit for, I'm sorry, I'm not sitting for 8 hours like that. You're not going to keep my attention. So understanding kids' learning styles and letting them explore those. Are they a hands-on kid? Are they a nature kid? Do they have to get outside and build something? Do they need to, explore? Is that that is equally as beneficial a way to learn as someone who can sit and focus at a desk for multiple hours. So it's understanding their environment, their need to move, their need to explore, their need to be in nature. And some kids just need less structured classroom settings. The other side of it is calming the central nervous system. And to do that is to understand the insults there, which goes back to some of the testing that we do. But how can you take that kiddo and bring them back to kind of their baseline? Can we teach younger kiddos, which you can, because I do it with my kids, certain breath work or taking little sensory breaks? So I have a little trampoline, and if Jackson needs to get some wiggles out while we're homeschooling, dude, go jump for a couple minutes, because I can tell he needs an outlet. He needs to get moving. He needs to get going. So he'll get a snack, he'll go jump, he'll go ride his bike for 15 minutes, and then he'll come back. And we'll get back to it.
Gets all that blood back to the brain, helps them focus and learn, and
exactly
all the cool things.
And it can help kids self-regulate naturally on their own by understanding their body and not being forced to kind of sit down and just work through something, but to understand when their body we all need breaks, but when their body, to understand when their body actually needs breaks, it can really help to kind of regulate their little systems.
And having this in place helps them be able to focus when it is time to focus and sit still and do the things that they need to do. So we're not saying that, they just need to be run wild and do whatever they want to do. There's structure around both sides of the structured learning and the freedom learning of doing all of the things, but it's all with the goal to help the child or the individual be successful in whatever they're doing, however that is helpful.
Right. So moral of that story is I do not believe ADHD is rampant. I do not believe it is strictly a brain disorder. It is multifaceted. And there's so much that can be done outside of just a traditional pharmaceutical that really does for some kids. It's wonderful. It's needed. It's a great tool to have in your toolbox. Is it something that you want your child reliant on, or is it can you take a root cause approach to figure out why this is going on? And that why for every kid is a little bit different. So that's the thought I want to kind of kerplop into people's heads, is just ask why.
Think about it.
Think about it.
Until next time,
let's discover together.
We hope you found today's episode with Rita Rogers to be both informative and empowering. Remember to apply this knowledge to your daily life and share it with others to promote greater awareness and understanding. Join us again for more engaging discussions that tackle important topics and provide you with the tools you need to make informed decisions for your family's well-being. Stay tuned, stay informed, stay curious. Before diving deeper into the wellness world, let's pause for a quick disclaimer. The information shared on this podcast is for general informational and entertainment purposes only. While we love being your Discovery Doc allies, we're not here to replace your doctor or healthcare provider. Consider us your fellow health explorers, sharing our findings as we uncover the mysteries of well-being. Always consult with a qualified medical professional before taking any action based on the content of this podcast. Just like an archaeological dig, this disclaimer may change occasionally, so be sure to check back for updates. Stay healthy, stay curious, and keep exploring with the Discovery Doc.